Hi, my name is Kristin Mihalcin. I'm the physician assistant for the chest wall program here at Phoenix Children's Hospital. Today I'm going to talk about Pectus Carinatum. Pectus Carinatum, also called pigeon chest, is a condition where the sternum or breastbone protrudes further out than usual. This is caused by an overgrowth of cartilage. Our sternum is a bone and our ribs are bones. Cartilage connects the two together. When the cartilage overgrows, it can cause the sternum to push outwards. It can also overgrow asymmetrically on one side more than another. This overgrowth of cartilage can also push the breastbone down. This is called pectus excavatum. We don't know exactly what causes the overgrowth of cartilage, but we do know that it's genetic, meaning if one person in the family has it, more people are likely in that family to have it. Here at Phoenix Children's Hospital, we take an in-depth medical history and do a thorough physical exam. We get a chest x-ray to evaluate for any intrathoracic masses that could be pushing on the chest wall and causing the protrusion. As long as that comes back clear, we're able to brace most patients. The best time to brace is typically during preteen and early teenage years. As patients with pectus carinatum grow taller, their defect typically begins to become more prominent and grow further outwards. As we age, our skeletons also mature and become more rigid. Once our skeletons have matured and the bones have hardened, the chest will typically stay that way the rest of our lives. However, if we're able to brace the chest with a patient when the patient is growing, it prevents the chest from going further outward, and as the skeleton matures, the sternum, ribs, and cartilages will harden in a much flatter, more normal way. We offer different braces that are customized to fit each individual patient. These braces are typically able to be worn under clothing and hidden fairly well. The braces are optimally worn 23 hours a day. However, patients have to build up a tolerance to this, so we wean them up on that brace. The length of time a patient needs to brace varies based on the individual patient, though we've had patients correct in as little as 2 weeks. The biggest factor in bracing is the patient themselves. They're the ones that have to wear the brace, and they're the ones that can tolerate a certain amount of time in the brace per day. The more hours in a day the patient wears the brace, the faster the correction. If a patient only wears the brace a few hours per day, they may not have a significant correction. Once the defect is corrected, the patient transitions to a retainer phase where they wear the brace at night only. After this is completed, the treatment is done and the patient usually doesn't need to brace again. Also important when bracing a patient is focusing on good posture. This allows us to correct the defect properly and help strengthen periscapular and back muscles. Pectus carinatum is not a life-threatening condition. However, many people benefit physically and psychologically when they have their defect corrected. If you have any questions, please reach out to our team today.